Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm. I'm a retired consultant surgeon, and throughout my career I had a particular interest in the care and treatment of cancer patients. Presently I am Chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk about blood cancers, a term that's used to describe many different types of cancer that arise in your blood, bone marrow or lymphatic system.
Our blood contains a number of different cells. The red blood corpuscles, which carry oxygen to our tissues, blood platelets needed to clot our blood when we bleed, and white blood cells, which are a major part of the body's defence system in fighting infections. Most of these cells are produced in our bone marrow, although our white blood cells are also numerous throughout our lymph glands and the lymphatic system.
Although there are many forms of blood cancers, the common ones are leukemia, lymphoma and myeloma. Interestingly, red blood cells and blood platelets do not have a nucleus, and as such cannot themselves become cancerous. However, the cells that produce our red blood corpuscles within the bone marrow can become cancerous, leading to a rare condition where there are too many red blood cells in the circulation, a condition which we call polycythemia vera. This leads to thickening of the blood and a predisposition to blood clots in the bloodstream. There are a wide variety of types of leukemia, which are named after the specific type of white blood cell they arise from and by the speed at which they develop. Acute leukemia progresses quickly and needs urgent treatment, whereas a chronic leukemia develops more slowly over many months or even years and may need little or even no treatment.
The most common is known as chronic lymphatic leukemia, or CLL for short. CLL usually affects the more mature members of our society. It's very rare in people under the age of 40 and tends to develop very slowly. At the other end of the spectrum is acute lymphoblastic leukemia, or ALL, which is usually seen in children and young adults and can develop very rapidly.
Lymphoma occurs when the abnormal white blood cells are largely confined to the lymphatic system and lymph nodes. There are two common types of lymphoma. Hodgkin's lymphoma, which affects the lymph nodes and is seen usually in young adults and those over 75. And non-Hodgkin's lymphoma, which is far more common and affects lymphatic tissue throughout the body, including the gut, and is predominantly seen in the over 60s.
Myeloma arises in the bone marrow from the plasma cells present that normally produce antibodies, and it is seen in those of 60 years of age or older.
So what are the symptoms of these forms of cancer? Many of the early symptoms of blood cancers can be rather vague and generalised. Feeling tired, fatigued, or generally unwell. Frequent infections or infections that are more severe or take longer to clear due to there being too few normal or healthy white blood cells to combat any infections. Breathlessness, tiredness, or headaches due to anemia caused by too few red blood cells. Bruising or bleeding easily. This may arise if there aren't enough platelets in the blood. The bruising may occur in unexpected places and cover a larger area than usual, with nosebleeds or simple cuts taking 10 minutes or more to stop. Sweating at night and unexplained weight loss. Other possible physical changes may include enlarged lymph nodes in the neck, armpits or groin, which are usually painless, a tender lump or a feeling of heaviness in the upper part of the tummy caused by an enlarged liver or spleen, or pain in the back, pelvis or ribs.
So what might lead to an increased risk of developing a blood cancer? The main factors seem to be exposure to radiation, prolonged exposure to certain chemicals such as benzene and some pesticides, inhaling tobacco smoke which contains small amounts of benzene, being overweight, having an impaired immune system, genetic factors such as a family history, or certain infections, particularly viral, such as the Epstein-Barr virus or Helicobacter pylori infection. But please remember that these are just risk factors. It doesn't mean that they will cause leukemia. It's just an increase in an individual's risk.
And of course, as we say every time, if you're concerned about any possible symptoms, talk to your GP. If something doesn't feel right for your body, talk to your doctor and get it checked out. It's always best to get any possible symptoms looked at. the chances are that it will turn out to be something minor, but early presentation and treatment produces better results.
You can find out more information on leukemia online at cancerresearchuk.org, and of course on the island you can contact the Macmillan Cancer Information Centre on telephone number 650735, or have a look at their website, which is macmillan.org.uk. Thank you very much for listening.